Pleased to welcome Dr. Colleen Fogarty, the Medical Director at Highland Family Medicine and the Associate Chair for Interprofessional Practice and Education. Back to the program. Good to see you, Doctor.
Good morning.
So breastfeeding has been in the headlines recently.
Yes.
The U.S. took a somewhat controversial stance at a recent meeting by the World Health Organization. Let's begin there because that's our topic. What was the U.S. position and why is it causing a bit of a ripple as people reacted to it?
Sure. So decades of really good science have shown that breast milk is the very best nutrition for babies, and that's very non-controversial. The language in the WHO resolution was that nations should protect, support, and encourage breastfeeding, and that's where the U.S. delegation wanted to remove those words. Likewise, there was language about nations discouraging the promotion of foods that are not helpful or healthful for babies, and that language was also what the U.S. objected to. That gets at marketing of infant formula and other kinds of supplements that may actually be quite dangerous for infants, particularly in areas where there is unsafe water.
As a doctor, what is the recommendation for new mothers then as it relates to breastfeeding?
So the recommendation is to breastfeed the baby, nurse the baby exclusively for 6 full months. We know there are many barriers to that. In New York State, we do actually quite well. About 80% of women start to breastfeed, but by the time 6 months comes, that number falls off to less than 1 in 3.
What are the benefits to the baby for babies who do breastfeed?
Definitely lots of health benefits. The research shows clearly that there are fewer ear infections, other kinds of respiratory infections, and gastrointestinal infections for babies in the first year of life. There are also fewer kinds of allergies, eczema, and other allergies. And for premature babies, this can prevent a very serious gastrointestinal complication.
What can people in general do to promote breastfeeding?
So it's a really great question because obviously new moms are the ones who do the breastfeeding, but the community and the social supports are incredibly important. So the mother's partner can become educated and be supportive, just instrumentally making sure there's time for breaks, making sure the mom is drinking plenty of fluids and eating well. But the extended family, relatives, people who may not know about breastfeeding can be curious, can really be supportive and make sure that there's a good place for the mom to do that. Likewise, workplaces and employers. New York State, there's a law that women be allowed to express milk when they're at work during unpaid or paid breaks, and that the employer is encouraged to make the best available, safe, quiet, private space for that mother who's expressing milk for her infant.
All right, well, our time is short this morning. We'll leave it there. Doctor, thank you. We appreciate it. The topic of breastfeeding, we got a couple of links along these lines that we'll be sharing online as well. You'll find this conversation and those posted at rochesterfirst.com.